I'm very pleased to introduce Michel Tremblay, whose experience is too lengthy to mention. Let me just say that he has had an admiration and respect for older adults since he was very young, and has worked in providing support to them during the course of his life in a number of increasingly responsible roles and positions. Michel is head of FARFO, the Federation of Francophone Seniors and Retirees of Ontario. His is an important message to SSAO members and to the Ontario government, which is well worth hearing. Welcome, Michel.
Thank you very much. When I was 18 years old, I moved from Quebec City to Ottawa, and I was going to Ottawa to study to be a priest. After 1 year, I was told to go and do some thinking about it first. So I took time off from education, and I was 19 years old, and I went to work as an orderly. That was the way it was called at the time, PSW today, in a municipal long-term care home for the aged. I really enjoyed my work there, and after 1 year, I didn't go back to school. I stayed and I became activities coordinator and worked for more than 9 years with Francophone seniors in Ottawa. At the time, municipal homes for the aged were divided into two sections. If you recall, there was a residential care section, mostly for people who were just need some basic care or some basic needs, they were admitted and they were funded through the Ministry of Community and Social Services. And there was another section called extended care. And extended care was for people that we know today as long-term care. And the mix of those two was making the home more like a home, more like a place to live and enjoy. So that was something that those are the years I really enjoyed working in those facilities. There were benefits to have both together. Healthier residents were sometimes visiting the floor where sick people were. And the way there were activities attended by all kinds of activities that was planned. I studied to become a long-term care administrator, and that course brought me to become administrator of another nursing home. And it was a time when there was a campaign called Martha and Mary, showing that Martha was living in a nursing home and she was treated differently than Mary was in a home for the aged. And that was an interesting time. In 1990, I became area manager in the Northeastern Ontario. I was hired as one of the 14 managers for the long-term care reform. And I was first base in Norbay, then became regional director in Sudbury. Those were the years of the NDP government. And there was a real attempt at the time for the government to change long-term care in home and in facilities. They decided to listen directly to seniors. And they met with the seniors organizations, and they didn't want to listen only to service providers. And what they heard from them was to have adequate services to stay in our homes as long as possible, to have seniors services provided by one agency, one phone number to call, one assessment, and for a defined population. And it was called multi-service agency at the time. And to have apartment with support services and not to increase long-term care beds. So this was proposed by what people said, and the NDP went ahead and started to do the change for this. In 1995, the Conservative government was elected and abolished the former government reform and created what we have learned as CCACs, Service Access, Community Care Access Centers, a replica of the previous home care program, and announced 20,000 new long-term care beds. My thoughts about how government is treating elders in light of this: I think conservative and liberal governments have not listened to elders over the next 25 years. They have had the years of the service providers, for profit and not for profit. They have maintained the same structure over and over, changing it from CCAC, to the LIN, to the home care and community services, with purchase of services from many providers and a huge number of community support service providers. It's a complicated system for elders and caregivers too. And after the first 20,000 long-term care beds, we're now looking at 30,000 more long-term care beds. What I believe should be done instead, I would like to see 4 main strategies. First, to invest in not-for-profit community service agencies with responsibility for service access, assessment, coordination, home care service delivery, and community support services, such as daycare, meal delivery, home health, food care, non-urgent transportation for a defined population. We could use existing community health centers and other similar agencies to do this, to stop building more long-term care beds and ensure that the current facilities are really homes, staffed adequately with quality of life programs and activation, renovate existing older homes that has not been done yet, and make 3 and 4 people bedroom illegal, to increase supportive housing all over the province as an alternative to long-term care homes, and to push for the creation of more active living centers where elders can congregate for activities, health promotion, disease prevention, and have a place to enjoy their life. So this is what I think we should be doing over the next years in terms of long-term care reform. And I think we have to listen to seniors for that. Thank you.
Thank you very much, Michel. It's an important message that we need to get away from the institutions and that we need to start building up the community, and especially your last message, that we really do need to listen to our elders for a change instead of ignoring them. So thank you very much.
You're welcome. Okay.